ما أريد من هذا الشعب إلا أن يزيد في الحمد والشكر إلى الله عز وجل، ويزيد من محبة الوطن، ويزيد من العمل ومضاعفة العمل لما يسعى فيه من خير له وللدولة والأهل. هذا اللي أنا أدوره من الشعب، وربنا إن شاء الله يوفقنا جميعا على ما يحب ويرضى.
تقرب منازلها إلا محب زايد أسسها واليوث وراه.
UAE rulers are remarkable persons, and God bless them. They have shown with their vision and their determination in implementing their visions that the healthcare in the United Arab Emirates is one of their top priorities.
Welcome, ladies and gentlemen, to your favorite program, Peers of Union, which invites the most successful people here in the UAE. Today from Dubai, in Fakih University Hospital, with the Dr. Nikolas Valsamidis, Consultant General Surgery. Welcome, Doctor. We are so pleased to meet you today, Doctor.
I'm pleased to meet you too.
Thank you so much. So, Doctor, let's talk about Fakih University Hospital and let's talk about the general surgery here.
Yes. Fakih University Hospital is a big hospital in the making. As pretty new in the history of Dubai health, but nevertheless has already made a very big impact in the local community and has offered all kinds of services within the medical field. Me, as a part of, I'm a consultant of general surgery, so working for Fakih has given me the opportunity to work with the best equipment and the best innovation in my medical field. It's a pleasure for me to be here. Nice meeting you, and I'm also pleased to be able to share my background with your audience. I'm a general surgeon. I've obtained my medical degree in Masters of Health Sciences from the University of Copenhagen. After that, I trained as a general surgeon in Sweden, and I've been working as a general surgeon for more than 25 years now, all around Europe. My background is multicultural. I come from a Greek family and a Danish family. As subsequent to that, I speak 6 languages since I've worked in many countries in Europe. I've been working with general surgery almost all my career, and I have dedicated myself, and my special interest is in minimal invasive surgery, mainly laparoscopic and robotic procedures. The diseases that I've been trying to, I'm focused on treating all my career have been diseases of the abdomen mostly. I'm considered what is called an upper GI surgeon, upper gastrointestinal diseases. So most of my surgeries have been treating conditions such as bariatric procedures, also obesity, mainly morbid obesity, but also more serious diseases like cancer and tumor surgery of the stomach, the intestines, pancreas, liver, and so on. I mentioned that I do minimal invasive surgery, and that is a very general term. It includes all kinds of procedures that we do with a laparoscopic, keyhole surgery, or robotic, which is the latest thing in minimal invasive surgery. Other kind of diseases that I've been treating with these techniques are hernia conditions, inguinal hernia, umbilical hernia, or even heartburn and hiatal hernia, which is a condition that is growing because of the modern way of life with a lot of anxiety. And people that get heartburn, they have an underlying condition called hiatal hernia, which they don't know of. And they have to get an endoscopy, a gastroscopy, in order to get it diagnosed. But when they do finally get it diagnosed, they then end up talking with me, and I have a perfect solution for them. And that is a procedure called Nissen fundoplication, which is basically fixing the backline cause of their condition. Apart from that, I also do more common procedures such as gallbladder procedures and acute appendicitis, if we are talking about acute conditions, and so on. That interest of mine has made me evolve in what I mentioned already is robotic surgery. And after a long career of 25 years, almost 25 years in Europe, I've decided last year to move to the UAE. And the reason for moving to Dubai was I saw a vision that Dubai is spending, and UAE is spending a lot of money in health care innovations. And that is really what attracted me here. At the moment, I think UAE is lying number 19th in the world, and maybe even 18th in the world in amount of money spent on medical innovation, which is remarkable. And together with the fact that UAE is number 1 in the world in fiscal investments and sustainability, that makes UAE inevitably going to be in the top 10 in the following years in general in world rankings of health systems. And that was the reason behind me deciding to come to the UAE. So worth mentioning is also the fact that I'm a full accredited general surgeon for the European Board of Surgery, and I have accreditation of the ATLS, American Trauma and Life Support. I was also an instructor of the ATLS course back when I was working in Sweden. I have been accredited as a master in minimal invasive procedures from Davos in Switzerland. I've been an HOD, head of department, for the last 12 years before coming to Dubai in my hospital, which was the last hospital I worked for in Athens, Greece. Now, apart from my career in surgery, I've also been working with insurance companies. I was a consultant for SOS International, which is the major insurance assistant for Scandinavian insurance companies. I've been a consultant for them since 2003. So I've always had it in me to come in contact with healthcare systems around the world. As one of my tasks was to help our insured clients, patients, to get the best possible treatment in the country they were based at the time, and helping them to get repatriated back to Scandinavia if that was needed.
So, doctor, as you know, it's not easy to enter the world of medicine, and especially when you choose your specialty. So, what are the hard challenges that you have faced during your journey?
Choosing a specialty after you finish medical school is a challenge by itself. This is almost always a result of interest that you develop while studying. Medical school is the longest in time studies in the world. You know, it takes, my university took, for example, 7 years to finish, to get your master's degree. So I've always had the will, and my vision was to be able to choose a specialty where I could see immediate result of my interventions, immediate result in the treatment of my patients. And one of the specialties I could see that was surgical. And since general surgery is the biggest specialty within all the surgical specialties, I chose that. And I've always been a kind of person that like challenges, and a lot of the conditions and diseases that you face when you are a specialist in general surgery are very challenging. So it really suited me like a glove, basically, choosing to become a general surgeon. Now, in order to achieve the best possible training, and in order to get to the highest level in my specialty, you are deemed to get a lot of inputs. And not the easiest, the best way to get inputs and information and from different cultures is to move around, you know, not to be in one place, but to try and balance between working opportunities, educational opportunities, and living qualities. So that's where when I was studying, I used to live in Denmark, which is one country in Europe, and then I moved to Sweden, which is another country in Europe, where I did my surgical training, my basic, and my most of my surgical training was in Sweden. And then I moved from there, and I went to Greece, because quality of life is also very important. It's also very important to have your major supporters around you, which is your family. And that's where my family was based. So I lived in Greece for many, many years. But then in between, I also took up challenges, and I went to move to Norway, and I worked in Switzerland for a while. So all that, yes, of course, it's not easy to move from one place to another. But nowadays, with the internet and the easy and how easy the transportation is, it's not so difficult to move from one country to another, as long as you have your priority straight and you know why you're doing it. And my driving force was to become better. My driving force was to achieve excellence in what I do, and that I thought, and I still think, that was why I did it. Moving to Dubai and to the United Arab Emirates was just another example of that. Yes, it is challenging, but as long as you have support from your family and your friends and your colleagues, then anything is possible.
Yes, of course. nurse, doctor. Now, doctor, let's talk about the first step to enter the medical field, and how do you create a clear mark in your field and be special and unique, especially in this competitive world that you are living in the UAE. So how did you achieve this recognition and attention?
Recognition, if you are choosing to become a doctor or you choose to work in the medical field and your goal is to be famous and rich and recognizable, then you're doing it the wrong way. You have to love what you do. You have to dedicate your life in medicine. You have to dedicate your life in surgery. And then if you do that, you will get recognized, because what makes a surgeon good is caring for his patients. And if you do care for your patient, and because you are that kind of person, that compassion and caring and the well-being of your patient comes first as a priority, then you will be loved, and people will prefer to come to you, and then this is how you become the best, successful, and the best in your field. There is competition, especially in the private sector, where I'm currently based at, in the UAE. Absolutely, but competition should make you thrive, and it shouldn't be the brake that keeps you behind. I personally think that competition is, especially in the medical field, promotes innovation, promotes going forward. So I welcome that.
And doctor, talking about the innovation and talking about the development in technology which is necessary in the medical field, how does the development in artificial intelligence serves the world of medicine and especially the general surgery?
Yes, artificial intelligence is something that everybody is talking about nowadays, and absolutely it's come to stay, and it has helped technology in many aspects. Even medicine, artificial intelligence is here and is helping, particularly trying to improve the best possible outcome of therapies and best possible outcome of treatments. And it will, and it already has a role in medicine, and its role will be evolved even more in the future, particularly in general surgery. AI innovations have helped and is helping planning. That is basically what it does now. It plans for the best possible treatment, and it plans for the best possible outcome for treatments. And that's why AI at the moment in the medical field is confined to diagnostic specialties, such as radiology, microbiology, or laboratories science. But slowly and steadily, it does find implementations in clinical specialties, such as general surgery is. The way it does that is by enhancing the surgeon's movements and decision making during surgery. We haven't gotten to the stage where an AI robot, for example, will be able to make the surgery by itself. And I'm not even sure that we will ever get there. And maybe that's not even what we should strive towards. I don't think that in the future a human general surgery surgeon will be not needed. But an AI will be able there to support the movements of the surgeons, will be able to support decision making of the surgeons before, during, and after surgery. And that's where I see AI's future in general surgery.
So, as you mentioned, doctor, in your opinion, doctors can't be replaced by robots, even the robots has performed the surgery now.
No, I don't think that surgeons can be replaced. I don't think that we will ever get there. You will always need the human touch to care for the patient. You will always need the human touch for the experience, the vast experience that you get over your career that cannot never be replaced. But together with the surgeon, AI can make the outcome even better, minimizing complications, for example. That's one goal we can have.
No, doctor, talking about your specialty that include general surgery.
General surgery is one specialty. It is the oldest specialty in surgery.
It includes the whole...
No, it doesn't. No, that's not what general means. General, 150 years ago, I'm sure your audience doesn't need to hear that, but 150 years ago, in the beginning of the previous century, mid-end of the previous century, 1880, 1890, there were surgeons and there were doctors. Doctors, they gave pills. Surgeons, they operated everything. Bones, skin, abdomen. They gave birth. They were surgeons. Slowly, specialties started getting away. Obstetrics, they were the first, gynecologists and obstetrics. They were the first that left. Then were the orthopedics, because they only did bones, Then there was heart surgeons, they only did heart, and so on and so on. Nowadays, general surgery is left behind as one specialty, but it's still the biggest specialty because it has all the diseases in the abdomen, breast, thyroid glands, vessels. So general surgeons, we do a lot of things, but there are subspecialties within general surgery. Subspecialties, which is obesity, laparoscopic, cancer surgery, oncology surgery. Those are subspecialties.
You can mention this or...
Well, I don't mind. I already said it in the beginning that I'm considered upper GI surgeon, which is one subspecialty of general surgery. Upper GI, that means all the intestines from here and up.
So, doctor, after your faithful journey, let's talk about the operation that you are proud of today. Some achievement and accomplishment that you have achieved during your journey.
That's a very good question. There have been so many, over my career, I've done thousands and thousands of operations. And if we only talk, for example, obesity surgery, which is the surgery for treating obese people. I've done more than 2,000 laparoscopic operations there. But what I'm mostly proud of, and I've already done some operations like that here in Dubai, are laparoscopic operations for cancer diseases. Because using the minimal invasive technique with doing surgery through small minimal incisions and being able to treat cancer disease, which does not only affect the patient physically, it does not only affect the patient mentally, it also, after surgery, it affects the patient because we need to be able to get our patient in a state where he is fully mobilized quickly and up and going and return back to his daily routine as soon as possible. That is essential to getting over that obstacle which a diagnosis of cancer causes. So one of the surgeries that I'm mostly proud of is treating liver cancer through minimal invasive procedure, through small incisions. And that is one of the surgeries that I've already done here in the UAE. And that was actually the first time that a laparoscopic resection of a liver tumor was done in the UAE. Other name-worthy procedures are laparoscopic and laparoscopic procedures for congenital malformations in the bile ducts. That was also something worth mentioning. And but you know, it's not fair for me to choose one or two type of procedure just for the fact that they are difficult and challenging to achieve, because I'm not here to do surgery for the challenge. I'm here to do surgery for helping patients and their diagnosis, treating their diagnosis. So therefore, yes, I've done some challenging operations in my career, but I don't place them any higher than everyday routine operations that I do. That help thousands of patients. Absolutely.
Great, doctor. Now, doctor, let's talk about your future plan. How do you see yourself in the future, in the upcoming period?
That is also a very good question. As a person and as a doctor, what drives me and what makes me be able to work every day with the same hunger and the same urge to treat patient is my vision. That has always been my trademark. And being here in Dubai just is a sign that is where I see my future, here in the United Arab Emirates. I am intrigued by the prospects of innovation in medicine and the prospects of innovation in general surgery in particular. And that's where I see myself. I see myself leading and teaching younger colleagues and how to perform robotic surgery and how to perform robotic surgery with the help of AI. And that is something that I would very much like to do, and that's how I see myself for the next 10 years, for example.
So, doctor, nowadays, thanks to its laws and regulations, the UAE attracts medical tourism.
That's right. We have a long way to go, but UAE is already up there, top ranked in the world in amount of patients received from abroad. So that has definitely put us in the map of leaders of medical tourism worldwide. But we still have a long way to go, because I think that UAE's potential is to be number one in the world in medical tourism, and that is another reason why I'm here, to help implement that. I was considered a pioneer in medical tourism when I used to work back in Greece. Medical tourism in Greece was not even in the map. When I started receiving hundreds of patients from abroad that came to Greece to visit me and my hospitals, doing bariatric procedures, elective bariatric procedures. Now I'm in Dubai and I thrive towards putting Dubai in number one, helping at least as one of the major pillars of evolving the healthcare system in Dubai is attractive patients from abroad. And I know that, and I know the visions of the rulers of this country, and I totally agree with that. And one of the major areas where we can attract patients from foreign countries to come to UAE and get treatment is serious diagnosis such as cancer diagnosis. And that is because we offer, here in the UAE, we offer the full spectrum of the treatment, from the diagnosing the disease to treating it on a primary sector, a secondary sector, and even on a tertiary sector. And another is cosmetic, of course, is always there. Cosmetic procedures. So, medical healthcare system in Dubai is extremely well developed, and it's ranked one of the top in the world. We already said that, and that is, of course, due to the vision of their rulers, and due to the large amount of money spent in the healthcare system in general. That, of course, by itself will attract patients from nearby countries, but not even nearby, countries far away, that would seek to UAE to get the best possible treatment for their disease, whether that is more benign diseases, such as everyday diseases, as diabetes or heart conditions or neurological conditions, to more serious diagnoses such as cancer diagnosis.
So, Doctor, you have traveled to many countries. After your faithful journey and rich experiences, the word of success is not strange to you. So, what is the meaning of success to Dr. Nikolas?
The meaning of success for me is being loved and appreciated by my patients. That's what it means. I mean, I couldn't care less whether I'm famous or my name appear on Google searches, or whether I'm invited as main speaker in big congresses and all that. The fact that my patients, they see me as their brother, seeing me as their family, because I don't just want to be a healer for somebody. I don't just want to be their surgeon or their doctor. I want to be their friend. I want to be their family, the one they can turn to. And I'm always open to being contacted by patients that I've treated in the past. I love that, actually. So that is the meaning of success for me.
So, Doctor, as you know, lots of people from audience, they are a new generation, and they see from your story something special inspired them. So what is your advice to the new generation of doctors?
Young doctors, or those that are thinking of becoming young doctors, is a very big chapter in medicine. And I'm proud of myself of helping lots of young doctors in my career. And the best advice I can give it to them is become doctors or become surgeons for the right reason. Don't become doctors, don't become healers for the fame or the money. Become to help people. That should be the thriving force. When that is done, then try and gain as much possible from your teacher. Your teacher, whoever it is, or whenever you meet them throughout your career, they will always have something to contribute. So listen to them and be acquaintance with what thrives them. And when that is done, then just treat medicine not only as a profession, treat it as a calling.
So, Doctor, you choose this country for stability and for work, for life also, because this country invests on skilled people. So the UAE has for sure contributed to your successful story. What is your appreciation message you would like to convey through our episode to the UAE and its rulers?
The UAE rulers are remarkable persons, and God bless them. They have shown with their vision and their determination in implementing their visions that the healthcare in the United Arab Emirates is one of the top priorities. That is the reason I'm here, and I'm sure that is the reason why a lot of my peers have chosen to be attracted by UAE. So God bless and hope that the rulers will strive towards taking UAE to the next level, which is being a leader in the world map of medical health.
Thank you so much, Doctor. It was my pleasure talking with you today. Best of luck.
Thank you so much.
Thank you. Dear audience, this is the end of our episode. Watch us next week. Goodbye.